Obviously, first we have the expectation gap. A lot of patients are expecting miracles or expecting the medicine to work fast like other medications. They're used to having some sort of even when you're building up, like with SSRIs or otherwise, they expect some sort of a sensation pretty fast. They expect some change pretty fast. And for medical cannabis patients who never used cannabis before and we want to prime them properly, it's gonna take maybe 2 or 3 weeks to even start getting them to increase the dose to an impactful dose. So we need to match this expectation gap because they might quit after 2 weeks because it doesn't work before it even got the chance to work. On top of that, obviously, built into the system, there's a feature that cannabis is a very reactive medicine. So the dose that works for you for week 3 or 4 will not be the same dose that works for you on week 8 or 9. We'll have to do all of this process with the patients so they get there. Now, let's look, for example, at the 72-year-old that goes to the dispensary counter. Now, it might be the right way or the wrong way. Either way, we need to support her. If she goes and walks in knowing exactly what she wants to get, feels that she's been heard, and that we already contacted the dispensary or the pharmacy ahead of time for her, she gets help, the exact help that she needs. She leaves, and she does it with confidence. The other way, the wrong way, is when she's going there just after she got prescribed. She's rushed. She's being dismissed by the guys because, come on, Ida, we have a line behind you. They see her as a one size fits all. They just sell her weed, not the specific medication she needs. She's trying to understand what's on the shelf. She gets even more confused because selecting from 70 or 700 products is almost impossible. And in the end, when she goes home, she doesn't know what to do with it. Now, sometimes a little more is a lot. This lady, for example, she got from the dispensary a joint with 26% THC. She got home, she started smoking it, and she got very, very high because that's exactly the wrong thing for her. She needs, for example, CBD weed with very low THC for her indications. We didn't even go through what she's suffering from. In the end, after she consumes it, because she doesn't know any better, as we said, nobody taught her better. So she takes the joint and she starts smoking and she feels nothing. So she keeps smoking and nah, still nothing. So maybe a few more puffs. 15 minutes later, the room goes silence. It turns over and she sees black. Next thing she knows, she's on an ambulance on the way to the hospital. That's why we say start low and go slow. There's the biphasic trap. The biphasic trap is about how much dose is really right for the patient. On one side of the biphasic trap, we have the low dose. Some patients get the full benefits from low doses. If they cross the threshold of the low dose, they will start losing the efficacy and getting more and more side effects, up to the point that it might create even more harm than good and reduce all of the benefits. I'll give you an example from a patient of mine, a true patient of mine, very unfortunate case. We had a 25-year-old Tourette's syndrome patient with OCD as well. He started out amazing. He started out and got to 0.8 grams a day of the 25% or 20% THC back then. It worked very well for his Tourette syndrome. He didn't have tics. He started being alive again and feeling like he can contribute to society around him. He went to school. He went to learn how to become a DJ. He was teaching in the class for new DJs. Everything was wonderful. Until at some point he was stressed before the exams and he started having OCD. And then he realized that he's going through the smoking because of the OCD, but he didn't stop and he didn't tell anyone. So from zero point 0.8 grams a day, he got to 5 grams a day. At that level, he started really feeling bad. He started getting more anxiety, brain fog, irritable. His motivation dropped. He started imagining things. But because he still had some relief, he thought, nah, that's the stress. It's everything around it. It's not the weed. Let me keep going. Maybe more weed will help. When he got to 10 grams of medical cannabis per day, his tics started coming back much stronger than before. His OCD spiraled. He had severe anxiety and panic attacks. He had depression. But worst of all, he suffered from severe case of psychosis. And we had to cut him off the medication and to get him hospitalized in a medical hospital for a while before going back and trying the medication again. And again, it worked in low doses. But again, at some point, he increased the doses, at which point the administration said, enough is enough. And they gave up on him, unfortunately, because I do believe that more guidance and more tutoring and coaching and hands-on coaching by somebody from the administration connected to the, like if the coach was connected to the doctor, like we do in our system, like we had in the beginning, but not in the middle, not when he fell between the chairs, he would have still been kind of okay, treated with low-dose cannabis, reduced tics, reduced OCD, reduced anxiety. But as of today, we cannot treat him with cannabis anymore. Psychosis is a problem. More is not better. Past the window, more is worse. Now, why is it a biphasic trap? Because sometimes more is more. I can say that for some patients, for some chronic pain, when it comes to neuropathic pain patients and to Crohn's disease patients where they have active inflammation, we see that the low dose, the first phase, does nothing to them. Until they reach the second phase, all they have is the feeling of high. They feel intoxicated, but not any medicinal relief until some point, until a dose that's pretty high, that's past the biphasic effect. And on the second phase, they actually get the relief. We don't know which one's which from the beginning. We need to be the ones guiding them, following up, making sure they don't fall in the trap, putting our finger to keep the pulse. That's our job. Another major trap is that there's no roadmap. As we said, patients don't know how to go. They don't know how to start. They don't know how to go. They don't know when to increase the dose or to reduce the dose. They don't have any means of knowing the increase or hold the dose or reduce the dose, or whether this medicine, this specific strain, is even good for them. They've been given a prescription. That's all. And now they need to figure it all out by themselves. So another hurdle, and we'll go into it deeply in the rest of the course, is the regulatory whiplash. No matter where we are, we see that there's the illegal market versus the legal market. We see that in some markets, we are completely legal as patients, and in some markets, we're considered to be illegal outlaws. Myself, with the Israel medical cannabis license, unless I convert it to a European Schengen 75 license, I can access only a few European countries with my medical cannabis. Whereas to others, I cannot access with my medical cannabis without the Schengen 75 from Europe. In the USA, I need to get a license per state. Am I a different patient? Do I need different medications? No. I'm just in a different legal framework. And this is a trap for a lot of patients because a lot of people these days are global. They work international. They travel with the kids. And without noticing, they get in trouble. And it's our job to help them with that as well, as far as we can. The rules move. The patient stays the same. Now, it's been almost an hour, and I'm going to ask you, based on that, what are you?